stories of tragic situations, and we all have them from our constituents across this great country. And it is absolutely essential for us to recognize that every single member of this institution does, in fact, want to ensure that every American has access to quality, affordable health insurance. The contemporary writer and commentator Dennis Prager has said that the bigger the government grows, the smaller the individual becomes. Now, Mr. Speaker, it seems to me absolutely essential that we look at what it is that is before us. It is a $1.2 trillion bill that has $569.2 billion in job-killing tax increases. It has provisions that will hire 18,000 new Internal Revenue Service agents to police every one of the 300 million Americans, to ensure that they comply with the new mandate that is imposed by this measure. Now, Mr. Speaker, we have, as has been said, a plan that will have taxes and regulations for 4 years and maybe some benefits in the last 6 years of the decade. We believe that we can work in a bipartisan way to do a number of things that will immediately, Mr. Speaker, reduce the cost of health insurance to ensure that every single American will have a better opportunity to have access to quality health insurance. We believe very fervently, and Mr. Cassidy has worked on this, that expanding health savings accounts will go a long way towards increasing access to quality health insurance. We know very well that pooling to deal with pre-existing conditions is something that will play a role to ensure that those with pre-existing conditions have their needs met. We know that we can drive costs down if we expand on associated health plans so that small businesses can come together and bring their rates down. And we know, Mr. Speaker, that if we allow for the purchase of health insurance across state lines, will create greater competition, ensuring that immediately our constituents will have access to quality, affordable health insurance. And, Mr. Speaker, we know, item number 5, something we've sent to the other body, but the Democrats blocked, and that is something the President also said he supported when he addressed the joint session of Congress, meaningful lawsuit abuse reform so that medical doctors do not have to engage in defensive medicine. Mr. Speaker, these are 5 common-sense proposals that we could address in a bipartisan way, I would hope, that will immediately bring the cost of health insurance down and not force every American to wait 4 years before they may have a benefit. Mr. Speaker, I urge my colleagues to vote no on the previous question and no on this rule, and if we get beyond it, vote no on the bill itself. And yield back the balance of my time.